What are genetic disorder risks for pregnancy and carrier status? Have you ever wondered what genetic disorder risks might affect your pregnancy and how carrier status plays a role? Let's break this down in a straightforward way. Genetic disorder risks in pregnancy can stem from inherited or new changes in genes or chromosomes. These changes can impact the developing baby. Generally, all couples have a baseline risk of about 2 to 5% of having a child with a major birth defect or genetic condition. However, this risk can increase based on several factors. One major factor is maternal age. Women who are 35 years or older at the time of delivery have a higher chance of chromosomal abnormalities in the fetus. Conditions like Down syndrome become more likely as age increases. Because of this, prenatal diagnostic tests such as amniocentesis or chorionic villus sampling are often recommended for women in this age group. Advanced paternal age, around 40 years or older, can also slightly increase the risk of certain genetic disorders due to new mutations, although this risk is less significant than that associated with maternal age. Family history is another important aspect. If either parent has a known genetic disorder or a family history of such conditions, the risk for the baby can rise. Some genetic disorders follow specific inheritance patterns. For instance, autosomal dominant disorders requiring just one abnormal gene from a parent to cause the condition, giving a 50% chance of passing it on. Autosomal recessive disorders need both parents to be carriers of an abnormal gene, leading to a 25% chance that the child will inherit the disorder and a 50% chance that the child will be a carrier without symptoms. X-linked disorders are linked to genes on the X chromosome and can affect males and females differently. Carrier status refers to a person who carries one copy of a gene mutation but typically does not show symptoms. Carrier screening can be done before or during pregnancy to determine if either parent carries genes for certain inherited conditions. This helps assess the risk to the baby. Environmental and medical factors can also influence genetic risks. Exposure to harmful chemicals, certain infections, and alcohol consumption during or before pregnancy may lead to genetic mutations or affect fetal development. Avoiding these risks can help reduce the chances of passing on genetic issues. Prenatal genetic screening tests, such as non-invasive cell-free fetal deoxyribonucleic acid tests, can detect some chromosomal abnormalities early in pregnancy. These tests are generally recommended when risk factors like advanced maternal age or family history are present. For those preparing for pregnancy, genetic counseling is a helpful step. It provides personalized risk assessment based on family history, ethnicity, age, and other factors. This guidance can help couples make informed decisions and manage potential genetic risks effectively.